This is Dr. Deborah Jeffries, Director of Healthcare Markets for Polycom. I'm coming to you today from the Andover facility, and we're going to be talking about telepsychiatry and how to support primary care in telehealth. Now, as you know, there's a lot that's been going on in healthcare recently. Not only do we have the challenges of trying to treat the baby boomers as they move into their 60s and beyond, but we don't have enough doctors and nurses to provide that care. And also, you'll notice, we have the patients that are located in remote and rural areas where it's difficult sometimes for them to get in front of an expert. So today, let's talk about how you can use Polycom's collaborative video and voice products to solve that problem. We're going to be using the Polycom HDX 4000, the Polycom CMA Desktop, and the Polycom Practitioner Cart to support telepsychiatry and telemental health. So let's start now by taking a look at what a typical telepsychiatry event would look like.
Good. I hope you're comfortable. It looks like you have a nice seat there. You feel okay? We're going to be talking for the next 30 minutes or so. Excellent. Well, Jane, if you could just tell me a little bit about what's going on with you since our last visit, that would be fantastic.
During a telepsychiatry visit, the patient is positioned in front of a Polycom Practitioner Cart. The far-end physician is able to move the camera on the cart to get a better look at the patient, zooming in close to see the smallest changes in facial expression. Today, H1N1 is a reality. Flu symptoms include fever, aches, and sore throat. The primary care physician will want to take a history and then do a physical exam utilizing attached medical peripherals from Polycom's Arena partners to look at the patient's ears, nose, and throat, as well as listen to heart and lung sounds. Let's take a look at the throat, for example.
Stick your tongue out for me, Jane. Great. And say "ah" one more time. Oh, perfect. Bob, just hit the freeze button there. I want to check something on her tongue.
Now let's take a look at the practitioner using CMA Desktop to look at the patient's throat from their remote PC location.
This could be allergy generated, so we're going to actually talk a little bit about some of the things that you are exposed to and see if we can't get you fixed up.
Well, as you've seen, we're able to use Polycom's collaborative voice and video products to support telepsychiatry, telemental health, behavioral health, primary care. In addition to that, you can also use these products to support cardiology, dermatology. One important application is telestroke, where you have the ability to bring in a neurologist over Polycom's equipment to hook up with their patient, review the symptoms they're having, and make a decision about appropriate medications. Not only is this beneficial to the patient's outcome, it makes it easier for the practitioner to access that patient. And it makes it easier for the hospital emergency room to accommodate the folks that should be there. So thank you so much for joining us today. If you have any additional questions, please visit us at www.polycom.com or call 1-800-POLYCOM and ask to speak with your account manager. Be well.